Welcome to our video about implant-supported single-tooth denture. Regardless of the type of denture you have, it may feel strange the first few weeks. You may have some soreness in the gums and tongue, which your mouth uses to keep it in place. As your mouth adjusts to the new denture, this should subside. If you don't have enough teeth, you may want to consider an implant-supported denture. An endosseous denture is anchored in your jawbone, so it won't come out. Nesbit partial dentures. The Nesbit partial is a type of flexible, one-tooth partial dental appliance. Like other partial dentures, this one requires accurate impressions. Digital chairside scanners are the best method for capturing the anatomy of a patient. Another option is alginate impressions. The pros and cons of using a partial dental appliance are detailed below. There are several reasons that a person would need a single-tooth denture. Another drawback to removable partial dentures is that they must be removed during the night. Ideally, the patient should remove the dentures at night to prevent fungal infections. Removing the dentures at night can be a hassle for many patients. They might also be embarrassed to reveal their missing teeth to their significant other. In either case, they risk having other problems if they do not remove their dentures. Valplast is another alternative for those who want a partial that feels natural. Valplast partials are flexible and hug the gum tissue, snapping into place around the gingiva and existing dentition. These partials offer tremendous comfort, as they are significantly less thick than acrylic dentures. Additionally, the malleable base of the Valplast provides stability while chewing. Regardless of which material you choose, it is important that you know the pros and cons of both types of partials. After a patient receives a single-tooth partial denture, it is important to follow instructions for aftercare. It is best to wear the denture for a certain amount of time before removing it to minimize sore spots. However, removing it will take some practice and following the dentist's instructions. The procedure will take several appointments, but you will soon get used to it. Once you have adjusted the denture, you will find it more comfortable. Cast metal partial dentures are one of the most common types of partial dentures. These dentures are built to last many years, and their rigid metal framework is covered by plastic that matches the gum. Patients may notice the clips connecting the metal framework to the remaining teeth when speaking, but the clips can be covered with tooth-colored materials to avoid visible metal. This design is comfortable and makes it easy for patients to live with a denture, despite the fact that it is not as strong as traditional metal ones. Fixed partial dentures. Fixed partial single-tooth dentures are an option for those who are missing just one or more teeth. These devices are made of acrylic material and are secured to the adjacent teeth by tiny metal clips. They don't provide a permanent solution, and they can place stress on the neighboring teeth. Despite their limited longevity, they are ideal for short-term use. Dr. Alan Chappell, a highly experienced partial denture specialist, will carefully examine your mouth to assess your needs. The most common form of partial denture is the cast metal model. These are incredibly durable and can last for years. The metal framework is covered with a plastic material that matches your gums. Although the metal framework may be noticeable, clips connecting it to the remaining teeth are made of tooth-colored material. These dentures are a great choice for many people who are missing one or more teeth. However, you should be aware of any potential allergies to metal or acrylic. While fixed partial single-tooth dentures have long been considered the standard of care for missing teeth, the pros and cons of these restorations are well known. Fixed dentures have many advantages, and they are affordable. They can help you get a complete smile and restore your confidence. They can also be very effective in treating caries and other oral health issues. However, you must be prepared to wear them for many years. For this reason, it is best to seek dental care as early as possible to avoid further complications. While conventional removable partial dentures are designed to replace one or more missing teeth, they can also function as a bridge. They can be removable, and some have clasps around healthy teeth. The fit of the partial is critical to avoid trauma to the natural teeth and gums. Moreover, RPDs are typically more affordable than other options. You may even opt to add additional teeth to your partial over time if you prefer. Implant-supported dentures. If you are missing one or more teeth, you may want to consider getting implant-supported single-tooth dentures. These are cost-effective ways to replace missing teeth. They mimic the appearance of natural teeth and are fastened to your mouth with dental implants. They are not removable, which means you don't have to worry about slipping or irritating your mouth. Additionally, they mimic natural-looking teeth and can be customized to fit your mouth's exact dimensions. Before recommending implant-supported single-tooth dentures, Dr. Morton will conduct a complete oral examination. He will check the jawbone for sufficient density and strength. A patient with adequate jawbone density is a good candidate. Patients with a weak jawbone may not be good candidates for implant-supported dentures. For those who do qualify, implants can provide many of the benefits of single-tooth dentures. Dental implants are durable and can support more weight than natural teeth. Implant-supported single-tooth dentures are a permanent solution for single-tooth missing. They blend in naturally with the remaining teeth, so they are easier to care for than a partial denture. The implant-supported dentures are also comfortable and stable, making them an excellent choice for patients with missing teeth. You can also choose between two kinds of implants, traditional single-tooth implants or the all-on-4 hybrid denture. Bar-retained and ball-retained dentures are also available. The bar-retained type attaches to 2 or 5 implants in the jawbone. They have a metal bar or clips that hold them in place. These dentures can be attached or removed easily. The bar-retained ones are often more secure than the ball-retained ones. If the dentist is unsure of which implant will be the best option for you, he will recommend one that best fits your needs. The implant-supported single-tooth denture procedure usually requires 4 or 6 dental implants to support the prosthesis. These implants are usually titanium screws, which are then allowed to fuse with the jawbone tissue over 3 to 6 months. This process is called osseointegration and is not always suitable for patients with weak bone tissue. A bone graft is sometimes required if the patient doesn't have enough bone tissue to support the implants. Endosseous dentures. Immediate loading of endosseous dental implants has been practiced in several centers around the world for a variety of dental prostheses, including single-tooth implants, posterior fixed partial dentures, and single-unit molar crowns. Immediate loading has been shown to have high success rates over extended periods of time, and it is now available for many different dental procedures. In general, this process involves placing the implant and restoring it within the same clinical visit. Implant-supported single-tooth dentures require 6 to 8 implants to replace a complete arch of missing teeth. This is unlike the all-on-4 concept, which requires only 4 implants. This type of dental prosthesis is more expensive than a traditional denture, but the benefits far outweigh the disadvantages. The prosthetics are stable and resemble natural teeth. However, there are some risks associated with the procedure. Immediate loading of an implant-supported fixed denture is essential to the comprehensive rehabilitation of mandibular edentulous. Unlike removable partial dentures, which require immediate loading, implant-supported single-tooth dentures are more secure and comfortable. However, patients should ensure that the adjacent teeth are healthy enough to support the prosthesis. Endosseous single-tooth dentures are an effective and comfortable option for replacing missing teeth. A titanium post acts as an artificial tooth root and is surgically implanted in the jawbone beneath the gums. Once implanted, the bone grows over the post, which is then attached to a prosthetic called an abutment. Once attached, a porcelain crown is placed on top of the titanium post. Unlike a traditional bridge, an endosseous implant does not touch the surrounding healthy teeth and can blend in with existing teeth. Mini implants are a more minimally invasive option for restoring a single tooth. Mini implants are designed to provide a strong foundation for a removable denture and prevent spontaneous floating or shifting. Implants are placed between the roots of the teeth and are attached to a fixed brace. However, this technique has the potential to reduce the treatment time. In addition to providing stability and security, mini implants can be highly effective for short-term or non-surgical cases. Thanks for watching. Please like, comment, and subscribe for more.